Hello and welcome to our special show, Coronavirus Facts versus Myths. This is the show where we get you all the latest COVID news. I'm Gargi Rawat. Now, India saw the lowest daily rise in COVID cases in 50 days with 1.52 lakh new infections in the last 24 hours. The country has recorded 3,128 deaths in that duration. Meanwhile, the positivity rate remained below 10% for the 7th straight day. So even as India's COVID numbers are in a steady decline, we now need to concentrate on boosting the vaccine drive to protect the maximum number of people and prevent a possible third wave from taking place a few months later. I remember right now a lot of states are under lockdown, and that's the reason the numbers have come down. Well, to talk more about this, we're now joined by Dr. Anne Wardle, Deputy Director General, Care Unit of the International Vaccine Institute. Thank you so much, Dr. Wardle, for joining us on the show. Now, in India, the cases are finally coming down. It's a definite downward trend. But this, while many parts of the country are under lockdown, so this is the time we need to aggressively vaccinate, though we are facing a challenge on that front.
Well, I have been following up, the situation in India, and we have actually our collaborators in IVI from India. Also, we have been very, very concerned about the situation there, and I'm glad to hear that now the number of cases is going down. I understand that India has been, in front line in terms of vaccine development. You have now in the country 4 vaccines being authorized for use. You have vaccines from AstraZeneca, from Bharat, from Serum Institute, as well as from Gamaleya. And then I've seen the number of cases rising there, even though you have 4 vaccines being authorized. And hopefully there will be more to come in. There are 10 vaccines being developed also, 10 clinical trials in India. So I believe that, having more and more vaccines being authorized will help you flatten the curve. And I understand, on the other hand, that looking at the percentage of the population being immunized so far is less than 10% in India. So definitely you need more and more vaccines coming in. On the other hand, you need to fulfill the 2-dose regimen of the vaccines being authorized to be able to somehow start seeing the decrease of the number of cases. But you need to reach at least 40% of the coverage of the total population to start seeing this decrease of the number of cases. So I think you should remain very vigilant in the country.
Right, Doctor. Now, there are 3 vaccines in India. We have the AstraZeneca vaccine called Covishield here. Now, there is a promise that we may get more vaccines from different companies, them coming to India and being available soon. In India, we've also eased some of the regulations like the bridging trials for proven vaccines. Do you think that's something that's needed now to escalate more vaccines and get them, more vaccines into our kitty as soon as possible?
Right. So there's different ways to have more vaccines. As you know, the vaccines that have shown very high protection levels have been studied in a very well-controlled, setting in the phase 3, the so-called phase 3, right, where you saw the results for the authorization of the vaccines. Now, once you have done the clinical trials, usually you want to see the value of the vaccines in a real-life setting, meaning that you want to see whether you give 1 dose would be sufficient. To have a good level of protections. You want to expand the interval between the first and the second dose, because in the clinical trials, the vaccine have been studied between 3 or 4 weeks. Now, there are some studies showing that if you expand the window between the 2 doses, you can get optimal protection as well. And then in other, there are other ways of looking at, improving the vaccines in post-authorization. There are now scientists looking into the what is called a mixed match or autologous prime boost, meaning that you receive 1 dose with 1 vaccine, and then you may be able to receive a second dose with another vaccine. So there are studies coming up showing, for instance, when you receive AstraZeneca, you can get boosted after the first dose with the Pfizer and vice versa. So there's a huge interest in the, I would say, scientific community to look at these combinations of different vaccines that could be given to have a certain level of protection that remain optimal. Right. So there are different ways to improve, the quality and also to improve the quantity of the vaccine coming in.
All right, Doctor. Now, what about the efficacy of the vaccines against the new variants? According to UK studies, the AstraZeneca vaccine, which is Covishield here, is over 60% efficacious against the B1617 variant, though it's come down slightly, it's above 70%. And now against this variant, it's come down to 60%.
Yeah, and I would say, some of the vaccines that are authorized, the front runners, have shown, the efficacy is lower against the certain variants of concerns. It has been the case for the South African variant as well as the B1617 in India. There are discussions around giving a booster dose, whether you give the booster dose with the original vaccine or you give a booster dose with the vaccine containing the variant of concern. So there are studies being conducted to see whether you can give another a booster dose with a variant of concern included in the vaccine.
All right, Dr. Wattle, now let's talk about disparities. And there's a huge disparity currently in the world, with richer nations having managed to vaccinate sizable portions of their populations, while poorer countries are left without access to vaccines. How do we get past this, and what can we do?
Well, what we can see now, all of us have been under this COVID-19 pandemic for a year and a half now. And I think that people start being exhausted. There's a fatigue, right? Saying, this lockdown in the different countries, you cannot go around without any precautionary measures with the mask wearing, avoiding crowded areas. So it has been a burden for the whole world for a year and a half now. And I see now that we are seeing this huge global gap in vaccination. Of course, some countries are starting opening up. Some others are facing, the COVID-19 surge. It has been the case in India. So to me, we need to still improve, the vaccine distribution. And my key message is to say vaccination acceleration is critical now, meaning that while it has been prioritized to give the vaccines to vulnerable population or priority populations because of the vaccine supply issue at the beginning, there is a need for accelerating now the vaccination beyond the priority populations to achieve a wider population coverage in order to interrupt the transmission. Because if we fail, in the vaccination campaign to control the pandemic, it will generate mutants and variants, and it will undermine the efficacy of the vaccine. So there's really a race, for vaccine development. And in addition, I would say on the top of the humanitarian and economic crisis, we may be facing a biological crisis.
And Dr. Wattle, I'd like to now talk about the situation in Asia, and there's a lot of concern about what's happening in Asia. Numbers are going up in Malaysia and Vietnam. There's a new variant. Japan seeing a surge as well of COVID cases. What would you say about these developments in Asia, especially since these countries had been doing very well earlier?
Yeah, when I look at Asia's situation, and Asia has been performing very well in terms of controlling the outbreaks of COVID-19. I think some countries in Asia, I would say, are victim of their success in controlling the outbreaks, meaning that they want to have zero case in the country. So since they have been performing so well, in controlling the outbreak in the country, as soon as you see some clusters, number of cases increasing, then you need to go into lockdown again, to close your border again. And I think that's one of the reasons why Asia in this situation, aiming for a zero case, situation, and maybe it's not the right way to do so. And I would say we need to somehow bring more vaccines to those countries because they are not prioritized compared to other countries because the number of cases has been low compared to other countries. So that's the reason why they may not have received, the vaccines on a timely manner, leading to that situation where you have, countries now with the COVID-19 cases surging again, and then they don't have the vaccines, enough vaccines to flatten the curve.
All right. Thank you so much, Dr. Anne Wattle, for speaking to us here at NDTV. Now, the other focus on the show today, some cases of serious eye infection have emerged in patients post-COVID. Endogenous fungal endophthalmitis is white fungus in the eyes that can even lead to blindness if it's left unchecked. These cases to follow intensive steroid therapy in severe COVID cases, like in the cases of black fungus that we've seen. Well, to talk more about this, we're now joined by Dr. Darius Shroff, retina surgeon and medical director, Shroff Eye Center, and Dr. Ritesh Narula, Senior Consultant Ophthalmologist, Center for Sight, New Delhi. Their article on this issue has also been published in the Indian Journal of Ophthalmology. Thank you so much, doctors, for joining us. Dr. Shroff, first, if you could tell us about this particular case and how common is it?
Thank you so much, Gargi. What I would like to mention is that this is a very rare entity. And before COVID also, we were seeing it, but we would see 1 or 2 cases in a year. But in the last 1 year, we've seen a real upsurge in these cases. And still, it's a very rare disease. But what was worrying was all these patients were patients who recovered from COVID-19. They'd undergone prolonged steroid therapy for the same. They were immunocompromised. And after they recovered, they presented with blurring of vision. And when we checked the retina, we found this, what is commonly called Candida albicans, which is like a white fungus. This was growing in the retina of these patients. So definitely there has been an increase in the kind of incidence of these cases. It was not unknown before, but post-COVID, we are seeing more cases of this rare condition.
Right. Dr. Ritesh, are these cases being seen mainly in elderly patients?
Hello, Gargi. Not really, Gargi. What we saw actually was these were younger, even younger, some of them were younger males who had had a severe kind of a COVID situation. They had to be admitted to ICUs, and there they received steroid therapy, and they presented roughly about a 2 weeks to 5 weeks period after their discharge. So it was not just elderlies, they were more younger age group patients also there.
Right. So, Dr. Shroff, so again, like in the case of black fungus, which we've been reporting on, this is again being seen as linked to the overuse of steroids and immunity going low. Is it also being seen more in patients who have other comorbidities?
Yes. So these were patients but I would like to make a important distinguish the two entities. Black fungus is a disease which originates in the nasal cavity.
Yes.
And then it spreads to the eye, and definitely it has much more mortality. What we found in the white fungus was these were patients, some of them have comorbidities, but a large spectrum of these patients were quite healthy and immunocompetent. The only immunocompromising state was that they were on long-term steroid. They were receiving oxygen, and they had IV lines for the COVID condition. And following this, they developed these sort of ocular manifestations, which led us to look deeper into the condition and diagnose them having this rare kind of a white fungus growing inside the retina of the eye.
Right, Dr. Ritesh. So the treatment for this is only to operate, and this, if it's left unchecked, it could lead to blindness.
Yes, if it is left unchecked, it can grow to a severe kind of infection in the eye and can lead to blindness. The treatment depends on how early we pick up. The treatment generally involves in endogenous endophthalmitis using antifungals in the eye, which is called as intravitreal injections. You use systemic antifungals in the form of oral or IV therapy. And if the condition is worsening and the condition of the retina or the eye is going more, is not getting controlled with this, we need to operate, do a surgery called as vitrectomy, where we remove the gel of the eye and along with it the fungal infection from the eye and give antibiotics to the patient.
All right, so it's important to catch it early. Dr. Shroff, if you could tell us, have cases like this been reported in other parts of the country or other parts of the world?
Yeah, so it's a good question. So initially when we started seeing our cases, we weren't aware of it. But now that I'm speaking to colleagues, so some of my colleagues in Bombay, Pune have reported such cases and have published also. And there's a large series from Hyderabad and also some colleagues in Ahmedabad and Bangalore. So all over the country, it's not a very high number, maybe 50, 55 odd. But I think this might increase. So we need to be aware of it and keep an eye out. Even we don't need to panic about it, but we need to be aware of it. and keep an eye out all across the country, because this is not phenomena restricted to Delhi, etc. It is happening all over.
Right, you can just imagine, especially in rural parts of the country where it could even be missed. Dr. Ritesh, if you could take us through what are the symptoms, what are the early signs that you have this, and clearly after recovering from COVID, patients need to be alert, especially if they were hospitalized and had a very severe disease and underwent extensive steroid treatment.
So what I would request for the general population is, if post recovery of COVID or after being through COVID, if at any time you feel that you have blurring of vision, or you feel floaters or black spots moving in front of your eye much more than normal, or your vision starts to become hazy, do not attribute and start home therapy. Do not consider this normal. Get yourself examined by an eye specialist, preferably a retina specialist, who can examine your retina, look for signs of fungal infections in the eye, and then accordingly refer and manage you.
Right, and it's important to create more awareness about this, isn't it, Dr. Shroff? Now, you've managed to catch some cases here in Delhi, and then you've spoken to other, colleagues across the country, and more cases have come to light. And the worry now is, of course, about how COVID has spread through rural parts of the country, and where they really have limited healthcare services. So the need is to increase more, awareness about these sort of issues, that people can be referred to, city hospitals or better hospitals, so doctors can watch out for situations like this. People needlessly will lose their eyesight.
Yes, I think that's a very important point, Gargi. The awareness is important because this disease mimics another disease called uveitis, which is not infectious. So in fact, the problem is that for the disease it mimics, the therapy is steroid, whereas for a fungal infection, the worst thing is to give more steroid. And all our cases which reported to us had been primarily treated with more steroid therapy, because it was initially misdiagnosed, because it mimics it. So it's something that if we are not aware of, it can kind of trick or fool anybody, even an experienced person. So it's very important to be aware of it. And the other message is that please, for the patients, don't self-medicate, because many times now over-the-counter chemists or etc. may give most steroid drops, ointments, etc. So please avoid this sort of a thing. As Dr. Ritesh said, seek the specialist, or at least go to your doctor, and then he will guide you further.
Right, and Dr. Ritesh, just finally, like black fungus, this is also something that exists in our environment and just catches these particular patients who are, immunocompromised post-COVID?
Very rightly put, Gargi. In India, because of the kind of atmosphere we have, the hot and humid kind of a climate that we have, fungus is a known entity. We see fungus in our houses also. You leave a bread outside and you catch fungus on it. So fungus are quite ubiquitous, they are present everywhere. It's just that they infect a human being only when the immunity goes down significantly. We used to see these kind of fungal infections in patients who had been in ICU for long, who had other comorbidities, severe diabetes. But now the worrisome thing is, post-COVID, we are seeing them in patients who have had extensive use of steroids. So COVID plus steroid is causing immunity to go down to the levels probably as seen in other severe immunocompromised state, and making them vulnerable to these fungal infections.
All right. Well, thank you so much, Dr. Ritesh Shroff and Dr. Ritesh Narula, for speaking to us on this issue. It's rare, but it's something that we need to watch out for.
Thank you. Thank you so much.
With that, time for a break. Coming up on the other side, our special segment, and we'll be joined by Dr. Praveen Chandra, who will answer your questions on vaccines. Well, time now for our special campaign, Vaccinate India, in partnership with Google. We're discussing questions that you may have about the vaccines, and we're joined by Dr. Praveen Chandra, Chairman, Interventional and Structural Cardiology, Medanta Medicity. Thank you so much, Doctor, for joining us on the show. And first and foremost, one of the questions that we get a lot is about the effectiveness of vaccines. Are COVID vaccines effective?
Okay. So I think, now it is amply clear, and it is absolutely correct to understand that these vaccines are effective. They are protecting people from, occurrence of infection, and the cross-infectivity rate will go down as more and more people are getting vaccinated. And it is expected that if we start vaccinating about 50 lakh people every day, we will be able to reduce the slope by 25%, the third wave. And if we are able to do it by 70 lakhs per day, we will be able to reduce it by 70%. And hopefully, I mean, God willing, if this can happen, 90 lakhs per day vaccinations, if it can happen in India, it can bring it to almost 0%. So we will be able to abolish it.
Right,
so that is the promise of vaccination.
Right, hopefully we can reach those numbers soon. When we talk about the efficacies of the vaccines, people hear about how some vaccines are 70% efficacious, 80%, and there's 90%. So if you could explain to us what this means.
Yeah, basically, what happens is that after vaccination, the amount of protection it gives to a person in terms of a population-based data shows that these vaccines may have some differences. But in general, the protection goes up to 6 to 9 months. Definitely on an average, it is about 9 months, and up to 6 months is very good. And it also depends upon how a person's antibodies develop. So some people develop very good levels of antibodies, some people develop medium level, and some people develop almost no antibodies. And in these patients, we might have to even give a booster dose at 6 to 9 months. But overall, anything above 70 to 80% is a very good number for any population, for any country.
Right, and people need to understand also that they're not 100% safe, so they still need to take care, isn't it? And you will see a few breakthrough cases of people getting COVID after vaccinations.
Yes, so people get, these ideas that somebody was vaccinated and he did, again, still he got the infection. Why did this happen? Why should I get the vaccination done? But the answer is that even if the vaccination is done, as you already mentioned, that we have to take the COVID prevention steps, which everybody knows. I don't have to repeat it again and again. It is mask, sanitization, and being away from each other, not going for parties and group meetings, etc. So in general, I must say that vaccination has to be adopted by people from every society, every country, every state, and then only it is going to help us. Otherwise, the other way around is to get infected and then get the the prevention. But I don't think that's a good way to go, because we have seen the scourge of this problem in the wave, which was very, very severe just a week back, 10 days back. Now it is on the decline.
Right, absolutely. And that's only thanks to lockdown right now. So we need to vaccinate more and more people. The other question that we get a lot is, are the COVID vaccines safe?
Yes. So as we have seen already, that we should talk about the vaccines which are being used in India right now, because it is more relevant for us. We don't have to talk about the other vaccines. There are so many vaccines being used worldwide. So the vaccines which are being used in India are 3, and predominantly it was Covishield, Covaxin, and now we have the Sputnik, which is being supplied. Now let me tell you, these 2 vaccines have been very extensively used and studied, and has been found to be very, very safe. There is no problem. And in fact, those people who have heart disease, those people who have high blood pressure, or any other treatment which is being given like blood thinners, there is no problem. We have given it to all these kind of people without any complications. And these patients tolerated the vaccine very well. And there is no serious issue about it at all, not even the smaller issues. I must tell you, just a day of fever sometimes, some body ache, and then it goes away the next day.
All right. Well, Dr. Praveen Chandra, thank you so much for speaking to us here at NDTV.
Thank you.
Thank you. Well, that's all the time we have on the show. Thanks for watching. Goodbye.